Hey everyone, welcome back to my channel. It's Dr. Alessandro. Please like and subscribe. In this video, I'm going to be talking about treatment planning for patients that have had cervical or gum line decay. So if a patient has had decay along their gum line and active decay within the past year or two, it's probably a bad idea to treatment plan crowns. So if you want to think logically, and this involves everybody in the team, whether it's the dental hygienist who's doing the cleaning and seems to think that there might be a problem, they can't diagnose, but they can certainly help indicate, hey, please doc, take a look at this. Whether it's the dental assistant, same thing. They may look at something and say, hey doc, something might not be quite so right here. Or the doc, whether they be a new grad, seasoned vet, doesn't matter. If there is cervical decay and it's been active within the past couple of years, it's a bad idea to treatment plan crowns. So why is that? Well, let's think logically. The gum line area is typically the junction of tooth and crown. So if a patient is unable to keep that area clean, whether it's because they are physically unable, whether they don't have good oral hygiene, whether, like I said, they actually physically cannot keep it clean due to handicap, some sort of an issue, or whether it's a dry mouth issue. And they are trying to keep things clean, but the dry mouth, the conditions of the mouth are making things, basically inappropriate for crowns to be done because the decay keeps on forming at the gum line. Then you have to think of alternatives because doing a crown will become an expensive project and an expensive failure. And then that leaves the patient unhappy, you unhappy, everybody becomes unhappy. Because things aren't working, and then a lot of money has been spent for things not to work. So if a patient has had active decay, especially in the past year or two, at the cervical area or the gum line, it is a bad idea to treatment plan crowns, and you need to think of alternatives. Then if they've been able to keep things stable, if they can change the conditions, improve their oral hygiene, be able to keep things stable and clean, make sure it's done for at least a year or two minimum, and then start to plan for crowns. But you need to be very careful because you don't want any kind of relapse. So make sure the patient's really on board with hygiene and can keep, has the ability to keep things clean. That way it gives the best chance of success. Never guaranteeing it, but it gives the best chance of success for these types of procedures to be done. All right, so hopefully this has been helpful. Thank you so much for joining me, and I hope you're all staying well and healthy.